The technological revolution has digitized many aspects of our lives, and now it seems our medications are next. The FDA has approved the first digital ingestion tracking system to help patients make sure they are taking their prescriptions. CBS News chief medical correspondent Dr. John LaPook is here to tell us all about it. All right, so John, when I first heard about this story, I said, wait, what? Yeah. I mean, this is a sensor. How does this work exactly?
Well, it's a tiny chip. It's like the size of a grain of sand. It's combined with the medicine, which in this case is a medicine for psychiatric illness, including schizophrenia. That combination of the chip and the medicine is put inside of a capsule. The person swallows it. When it hits the stomach, there's fluid there. And that fluid makes the whole contraption send a signal to a patch that's on the person's skin. That patch then sends a signal to the smartphone and says, take in the medicine.
Okay, so I can already hear some of our viewers are going to be like, that sounds like Big Brother. What are the ethical concerns here?
Right. Well, there are ethical concerns. I've been talking to my colleagues, to bioethicists, to the company.
Right.
And the company itself knew that there were going to be ethical concerns. They hired a 4-person ethical committee, and I spoke to one of the people on that to talk about the issues. Of course, people are worried about privacy issues.
Right.
You know, you have all this data out there.
Hackers.
Who's going to have access to it? But when you think about it, Elaine, there's information in electronic medical records that are in hospitals and everywhere. This is going to be a problem everywhere. It's of concern, but it's a problem. You think about why it's being done in the first place. About 50% of people who take medicines don't take them the way they're supposed to.
50%?
About 50%. And then that includes people who are taking psychiatric medicines, but also people with diabetes and high blood pressure. So there is a huge problem here, and they're trying to take technology to try to solve it.
So psychiatric medications now, what about what's next? I mean, could this have other applications then? People with other kinds of illnesses?
Yeah, I mean, you know, before we leave psychiatric things, you know, one of the concerns that people have are, you know, will the insurance companies pay for this? Are they going to say it's too expensive? Will they force somebody to pay for it? Will they say, well, if you have a psychiatric illness, if you take this medicine, then you're going to save us money by preventing hospitalization down the line, and that could go for other illnesses like diabetes and high blood pressure. And then, you know, really out there, but you never know what happens. Could a judge require somebody to, like, wearing a tracking device, you know, to do this technology so that can make sure that the person taking that technology? I mean, you know, at the beginning it sounds great. It's a technological tour de force, which it is. But with any new technology, you know, I mean, when you think about this, right? What could possibly go wrong? right? So you think about, you know, at first it seems great, but then you have to really be thoughtful about it.
Yeah. So the rules have not been written necessarily yet.
They haven't been written, and not only that, but it hasn't even proven that it works. So it's technologically working, but does it improve compliance, which means does it make people take their medicines on time? And that's to be shown. Only about 500 people have taken it so far. The company, we spoke to them just recently, you know, this afternoon, and they said, well, they're going to roll it out slowly, and they're going to only to select people. It's very important to say that people don't have to do this. This is a decision between themselves and their doctor, and they can just take the patch off, or they can delete the app. So it's not something they're being forced to do.
I'm thinking of like people who have elderly parents, for instance, and there's a host of medications that they might have to take, and there's certain end dates for those medications. This seems like that could potentially be helpful, and maybe family members could help track that.
Absolutely. You know, right now there are things like pill boxes, there are other technology, but anytime you're doing something every single day the same thing or the same pill, you know, you can forget, did I do that or not? You know, when I shampoo, sometimes I forget whether I've shampooed, right? And then standing there in the shower, did I shampoo? And then you shampoo again, and it lathers up real quick. Okay, I shampooed. So anything that you're doing over and over again, you can forget, did I just do it? Even if you just did it 10 minutes ago.
Yeah, it'll be really interesting to see how this technology progresses. Dr. John LaPook, always great to have you. Thanks, John.
Thanks, Elaine.
The FDA approves a new pill. I know. What does that have to do with technology? The answer is tonightsdaily.com. And what could be a game changer in the health industry, the Food and Drug Administration approves the first ever drug tracker pill. The landmark regulatory clearance underscores the high-tech evolution and how drugs are delivered into the body. This one is going to let doctors know whether you've taken your Abilify pills. This is how it all works. The ingestible sensor inside the pill is activated by stomach fluids. Once you take your medication, that information is then relayed to a patch worn on the torso, which then shoots the data over to a smartphone app. It's really small, about the size of a grain of sand, and apparently made up of ingredients that you'd find in food. Doctors and healthcare providers have to get your permission to track the data first, much like those opt-in car insurance tracking devices where customers can get a discount if they install the device in their vehicles. But it's not just with driving. People are turning to digital tracking to help stick with all kinds of regimens: exercise, diet, and spending. The idea here is to help people remember to take their meds. But some critics are calling it Big Brother and are a bit suspicious because the drug is combined with treatments for mental illness. To that, the FDA argues the opposite, saying the digital pill could actually be helpful for patients with mental illness since taking their medications as prescribed is so crucial. Abilify was first approved by the FDA in 2002 to treat schizophrenia. Supporters of this latest technology say that it presents an opportunity to claw away at some of the estimated $300 billion in wasted medical spending caused by patients not taking their medications. But it's interesting to note that the drug maker hasn't shown where people using this digital pill are any more likely to take their drugs.
The U.S. Food and Drug Administration has given the green light to a new medication that will track whether a patient is following their prescription. Some ethicists, though, say it's a tough pill to swallow. Tashana Reed with more on what is being called a digital pill. Tashana.
Well, Heather, I'm going to go right into explaining exactly how this works. So what this is it's a medication that is embedded with a sensor, and this is something that the patient would take and ingest orally. And so the sensor contains a copper and magnesium and silicon part and generates an electrical signal when it comes into contact with stomach fluid. So as the person takes it, it hits your stomach juices, and that is when within a few minutes a signal will be sent out, and that signal is detected by a patch that is worn above the left rib cage. So that patch then sends the date and time of when that pill was ingested to the patient's cell phone app. And so that's what's very interesting here. This is an app that the patient would download on their phone, and I'll show you an image here because from here the patient can tell the application what their mood is at the time, when they've actually rested, and also they can have this information sent to not only their doctor but people that are part of their medical team or support team, so maybe family members or support workers. So this technology was created by a company called Porteous Digital Health, and they teamed up with a pharmaceutical company. And in particular, this approval comes for a medication that is for patients with schizophrenia, depression, and bipolar disorder. And doctors are hoping that this will ensure these particular patients to take their medications when they are supposed to, because many people dealing with mental illness don't necessarily take their medications because of some of the side effects. So that is what doctors are hoping for, but many experts saying that this approval is a huge step forward when it comes to digital health.
Well, in what way? I can certainly understand the non-compliance issue, hopefully helping patients who have some concerns there. But how else do doctors see this as being more advantageous?
Well, one of the biggest challenges doctors say is the number of people who don't take their medications accordingly and how they are prescribed to. And what ends up happening is people get sicker. And so what that means is it's costing the United States $100 billion a year. That's what experts say is the final total because of further treatment or hospitalization when people aren't correctly taking their medication. Now, experts also say this technology can help in a vast number of areas, including for people who potentially forget to take their medication. They've also suggested patients who've had surgery and need to take opioids to make sure that they are also taking those appropriately. So there are many other medications similar to this and technologies that are being developed. This approval means that a lot of those can potentially go forward, but as you mentioned, a number of ethical issues as well. Many people saying that this seems a bit Big Brother, having all of this monitoring around someone taking medication.
Patients who don't take their medicine as directed not only risk their health, they cost about $100 billion a year, according to one study about avoidable costs in medicine. That's because the patients often end up sicker or needing additional treatment. Enter a new digital pill, just approved for use by the U.S. Food and Drug Administration in people with schizophrenia, bipolar disorder, and other forms of mental illness. It actually lets your doctor know if you've taken it.
The problem of not adhering to treatment when it's administered on a regular basis, daily, multiple times a day, and the way that compromises the effectiveness of the treatment is a huge problem in medicine, and particularly in treatment of mental disorders.
The pill's sensor is made of copper, magnesium, and silicon, ingredients already found in foods. It generates an electrical signal when it comes into contact with stomach fluids. That signal is then picked up by a wearable patch on the patient's rib cage. The patch sends the date, time, and patient activity level via Bluetooth to an app on the patient's mobile phone and a database to which researchers have access. Through the app, the patient can have a record sent of every time he or she takes the pill to up to 4 people, family members or caregivers. But the technology raises questions about privacy. Medical ethics experts find the fact that the pill is prescribed for mental illness especially troubling.
If you give someone a pill that's going to record for someone else whether they've taken the medication or not, it poses problems. These are people who may not understand all the issues because they involved because they have a psychiatric condition, though many people with psychiatric conditions can understand all the issues. There are problems because this may feed into their paranoia. They may think, oh my God, people want to spy on me, and now the doctor's saying he's going to give me a drug that's going to spy on me.
The cost of the drug is another concern, prompting experts to say more study will be necessary to weigh the risks versus the benefits and make this pill easier to swallow. Kristen Salumi, Al Jazeera, New York.